to and near and dear to most and all of us in this who's on this chat this afternoon. My name is Darius Quinn. I am a Human Resources Manager with the Kent County Human Resources Department and also a Diversity Officer for the Kent County Administrator Controller, Wayman Britt. We have a number of speakers who will be presenting here this afternoon, but for those of you who are wondering if this conversation will be recorded, the answer to that is yes. Mary Beth Van Til, who you likely have received your invitation from, she will be the keeper of that record and will be happy to share instructions with you on how to access the recorded line. So without any further ado, we're going to go ahead and get right on in to the heart of our discussion here. And at this point in time, I'd like to turn it over to Teresa Branson, who is our Deputy Health Administrative Officer. Teresa, are you there?
Yes, thank you, Darius, and good afternoon, everyone. Thank you for joining us today. We really wanted to take time to meet with you, share with you a COVID update, and allow some time to really hear your questions. Our mission at the Kent County Health Department is to serve, protect, and promote a healthy community for all. The Kent County Health Department is your health department. Everyone on this call, members of the community, we're all part of the local public health system. So really, whether you are on the phone today representing a business, as a community member, organizations, nonprofits, schools, maybe you're a parent, grandparent, husband, wife, friend, or colleague, we really need everyone in this fight against COVID in our community. And that starts with all of us. It starts with all of you. And we're just really calling on everyone to make sure that we can get your questions answered to the best of our ability, to make sure that you stay connected and that we find out how we can best do that.
What are you doing right now?
We have started to receive some calls and questions already that have came in. I want everyone to know that we welcome those questions. We want to hear from everyone. We'll do our best to get those questions answered on the call today. Anything that we're not able to address, we will follow that up with the frequently asked questions. But just want to encourage everyone to stay with us as it's going to take a community. It's going to take a community across Kent County and across the state of Michigan and beyond to really continue to stay out in front of COVID-19 and to take every preventative measure that we can. So again, thank you for joining us for this call today, and I'll turn it over to Wayman.
Good morning, everyone, and thank you, Teresa, and thank you, Darius, for your opening comments. As your county administrator, I'm very pleased with the way that our county has responded thus far to COVID-19. Many of you are aware of the measures that the governor has taken, along with the county. I believe that Kent County, based on the results that we're having, actually has responded very well. Right now, we're looking at 313 cases as of this morning of COVID-related illness. We have 13 who passed away. With that said, if you can compare how we're doing against the rest of the state, I would say that we're not doing too bad, but we're not doing good enough, and that's why we're on this call today. I want to make sure all of you know how serious this is. I'm very fortunate to have a team with me from our health department, from all sectors of the county, our sheriff's department, our mental health department, Network 180, and all of the various departments that have joined together to work with the community to deal with this pandemic, this worldwide issue, unlike we've never had before. We've enjoyed immeasurable success as a county, as a region. However, there are still some problems, as you all know, especially when it comes to our disenfranchised community, our African American community, where when things like this happen, when crisis hit, it's very apparent really what happens to those who are not as fortunate, who are not as connected to the resources that are available to the broader community. And so we're very thankful that you've joined us today to give you an opportunity to listen in, to understand what's happening with COVID-19. I can tell you that we have had a number of sessions with our local units of government. We have a weekly meeting with all of our municipalities, our townships, our cities, and with our Board of Commissioners to inform them, to brief them, to help them, in fact, to respond to this COVID outbreak. One of the things that I pride myself in is simply being open for questions and comments and communication, and I believe this is a good platform for it. We want to make sure that we make you as intelligent, as knowledgeable as possible. So this is why we've joined together today, to give you an update. Like you, I'm staying 6 feet away, and I'm making sure that I'm not putting myself in harm's way. This is how we flatten the curve. If we do what we're expected to do, we will see this curve flatten. And I believe that that's why you see some of the success that we've seen so far. The county is operating, but we're not operating like we were. The administrator's office is basically shut. Our only departments that are actually functioning are our juvenile detention center, our sheriff's correctional facility, and of course all of the other emergency responding apparatuses that we have. Our health department, of course, is on the front lines. They are highly engaged. Most other employees in the county, I would say 90%, 95% of us are working remotely. And I give a big shout out to our IT department that's helped to make sure that we can communicate. There have been a number of, I would say, successes had. One thing I'd like to highlight is just the tremendous help that we've been getting from our emergency management organization in making sure we rein in the resources for our first responders. We hopefully are going to be receiving additional N95 masks here soon this week to make sure that the first responders have them. We continue to work with our hospitals and all of those who are on the front lines dealing with this outbreak. We have been really fortunate to have great partnerships with our business community, with our Right Place, with our Chamber of Grand Rapids, with our Black Business Chamber. We also have been very fortunate to have many others that have asked how can they help. A business community, business leaders, philanthropic community have all joined in. In fact, we have a meeting tomorrow with our county's Family Children Coordinating Council to talk about what we can do to fund and support those involved with essential needs, our homeless community, and so forth. So we are locked and loaded. It's just amazing how we've responded to this, but there's still much to do. So I will stop there and just say thank you so much for giving us an opportunity to address you this afternoon. And I'm going to turn it over to Dr. Adam London, our Administrative Health Officer, who will give you a further update on COVID-19, a situational update, and framing the impact. Adam London. Thank you,
Wayman. And so everyone knows, Wayman is the captain of our team here in Kent County. And this has been more than a Kent County Health Department response. It's been an all of local government response. And we've had great leadership from the top down and from the bottom up. And it really is all hands on deck, including all of you. And so I really want to appreciate and thank all of you for your leadership and for the work that you have all done in the community to model the way, because we have had some wins. Our goal from the beginning here in public health has been to flatten the curve and save lives. And we've heard a lot of that term, flatten the curve, over the past few weeks. So you know, the models that we were looking at originally showed that if nothing was done, about 80% of the people living in Kent County would have been infected over the course of the next 6 to 8 months. And we would have lost 5,000 to 10,000 Kent County residents if nothing had been done. And that's largely because this virus is severe, the illness is severe, and if we overrun the capacity of our hospitals to provide care, then people aren't going to get the needed service they need, and we're going to lose people that could have been, lives that could have been saved. So about a month ago, we were seeing the number of cases double every 3 to 4 days, both here in Kent County and across the state. That's a very concerning rate of increase. Since the stay-at-home order has been in place, and since the social distancing and all of the other practices, hand washing and sanitation that everyone has been following over the past several weeks, we're now seeing that rate of double be every 8 to 9 days that the rate is the number of cases is doubling. That's called flattening the curve right there. What we're doing right now is working. And so I want to just appreciate and thank all that everyone is doing. Our hospitals are also in good shape. We communicate with them regularly, and their bed count is good right now. They have the ventilators they need right now. And so we're standing in good shape right now. We're also, however, cognizant of the fact that things could change in a hurry. And so it's important that we maintain some discipline here and that we hold to these practices for a while to make sure that we don't see a huge turn back or an increase in cases. We're also carefully watching data from New York and Detroit and elsewhere, and data that show that African American communities have been disproportionately impacted by that, by the outbreak, and that's very concerning to us. Here in Kent County, as of right now, about 21% of the cases that have been diagnosed have been people who identify as African American. And as you probably know, according to the census, only about 10% of our Kent County population identifies as African American. So we're seeing what looks to be a disproportionately high rate of cases here in Kent County in that population. But there are a number of variables that need to be considered as well. It is still a small sample size, so it's hard to draw firm conclusions right now. But it is enough that we are concerned very much about that here in Kent County, and certainly the lessons from New York and Detroit and elsewhere tell us that this is a priority that we need to focus on. Thankfully, none of the deaths that we've seen thus far have been people who identify as African American. Some of the reasons, it's still early in this epidemic to know what all the reasons are for this disproportionate impact. We know that housing and that long-term historical institutional racism are factors. We know that disparity in access to socioeconomic resources are factors. There are any number of factors that need to be thought of and considered as we work through this. What we don't think is, we don't think that that African American people are genetically somehow more susceptible to this. It's not. It's very unlikely that it's genetics. It's far more likely that it's other socioeconomic factors that need to be considered. And that's not new or unique to coronavirus, of course. These are issues that have affected disproportionate rates of heart disease, diabetes, hypertension, HIV/AIDS, and any number of other health issues that we've been concerned about for a long time. We are looking at how do we improve access to testing for all people in the community. Cherry Health has recently opened up more testing for anyone, and that's helpful. We know this is largely a communications struggle, and so we want to partner with you and others to make sure that the messages that are so important for prevention and for access to care right now are getting to everyone in the community. That's a priority of ours. And it's also a priority to think about what happens in the next phase. So this first phase has really been about bracing for impact with the arrival of coronavirus in our community. It's been about flatten the curve and save lives. As we move to the next phase, we need to think about how do we all thrive during the many months that exist between right now and a time in the future where we have vaccine available. So how do we reopen the economy and schools and everything else in a smart, strategic way to protect everyone in the community, while also recognizing that poverty is a health issue, and mental health is a health issue, and violence are health issues, and substance abuse. There are so many health issues that are being exacerbated by this pandemic that we all need to be mindful of and work together to find solutions going forward. So I'll stop there and turn it over to Dr. Bora, but I just want you to know that we greatly appreciate everyone on the call today. We greatly appreciate your leadership and your partnership with us as we all work together on this important issue.
All right, thank you, Adam. So my name is Nirali Bora. I'm a family medicine doctor and the medical director of the Kent County Health Department. So definitely thank you for joining us today. It's really important that we're all here together, working together to address this issue. We know that there are health inequities in our community, and we really want to do our best to ensure that these health inequities don't really play out in COVID. And we're seeing some evidence that it already is. So however we can brainstorm together to make sure that this doesn't continue is really our goal. So I'm here to talk to you a little bit about what to do if you're exposed to COVID, what to do if you test positive. And as Dr. London said, testing capacity has been fairly limited up until recently. Only certain people, either people who are hospitalized, people who are healthcare workers and they have symptoms, or people who live in like a nursing home and have symptoms, have really been able to get tested. But over the past week or so, things are gradually expanding, and hopefully next week we'll see that there will be more testing for other people in the community who have symptoms, but may not be one of those higher prioritized categories by the Center for Disease Control. So as Dr. London mentioned, Cherry Health is an avenue for testing. They have a hotline number that's open from 8 to 5, Monday through Friday. When someone goes through their telephone screening, they can schedule someone usually the next day to get a test done for COVID if they meet their criteria. Spectrum Health Med Now is also open to anyone. Anyone can call their screening hotline number, and if they meet their criteria for testing, then they can also be scheduled for a test. And then if they're patients or people who go to Mercy Health, they have their own way of deciding who can get testing done. But if it doesn't work through there, then Spectrum and Cherry are two other opportunities for people. So if someone is exposed to COVID, and it's really hard to know right now because we know that it is spreading throughout the community, so it's really hard to know who has it and who doesn't, especially because our testing has been limited. But if you know that you've been in close contact, spend time, 15 minutes within 6 feet with someone, or living in a household with someone who is tested positive, the important thing right now is to quarantine for 14 days. So what that means is to stay home and really limit exposure to anyone outside your household. Another important thing would be just to watch for symptoms. So watch for things like a cough, difficulty breathing, chest pain. Any of those things would be concerning. If you start having difficulty breathing or chest pain and you know you've been exposed, definitely that would be a reason to go to the emergency department. If you have underlying health issues, such as high blood pressure, diabetes, heart disease, or you're over the age of 65, again, just be extra cautious and paying attention to what your symptoms are. Any difficulty breathing, please don't hesitate and call your doctor. If you do test positive, it's going to be some of the similar instructions, but it would be to stay home. At this point, try to limit contact with anybody else. And I would really have a low threshold to, again, talk to your doctor. If you feel like you're not feeling well, something isn't feeling right to you, please don't hesitate to call your doctor. We're definitely seeing that people who get seriously ill from coronavirus tend to get ill pretty quickly. About 80% of the people who have coronavirus will have mild or moderate symptoms and will do fine. The other 20%, some of those people can get quite ill, and that can happen quickly. So if you're ever at all concerned, please call your doctor or go to the emergency room. And those are the main things that I have, but I'm definitely happy to answer questions later on. I'll hand it over to Wayman and Teresa. Thank you.
Thanks, Dr. Bora. And Teresa, I'm going to just say a couple of comments and then you can take it from there. I really applaud Dr. Bora and Adam London for how they've managed this. This has been, from the beginning, a 24/7 operation. Just so you know, the health department stood up the incident command system and have worked diligently with our emergency management office and our EOC to put people in a room together. And now, of course, we've pulled away from the room pretty much, and now we're working satellite to make sure that we don't spread or infect anyone if we come in contact. But they've done a really wonderful job, they and their team. We have a wonderful website that's been erected, or additions to the website on Access Kent. And Teresa will probably talk a little bit more about that. But if you go on Access Kent, there's a plethora of data, information that you can find. where to get resources. There's a chart, in fact, that talks about how we're doing. Adam mentioned that we currently have no African American related deaths for COVID. There are, however, a number of cases that have been identified. 20.1%, I believe that's the number, 21% compared to the overall. So that data is there for you to see, and I believe it's shown on the screen here. Thank you, whoever put that on. I think MB did that. You can see the number of cases there, 300. Actually, the number is 313, I was told, and 13 deaths. The deaths are the same. But this information is there for you to use and to educate those in your circles. We've also had a number of conversations with the governor's office over the last few weeks. I really want to give a shout out to Poppy Hernandez from the governor's office, who has been in daily contact with me and a number of the people that are within the county, the health department, as well as our communications team. We have been very fortunate to have that ability to communicate with them, and have challenged them at times to think about how to deploy the executive order to make sure that we don't lose sight of the fact that we still have to live and rebound from this. I really appreciate the fact that they've not turned a deaf ear to listening, but I can tell you that there are a number of people in the community still yet that are saying, what can we do to make sure that we don't simply turn off the community from being able to have a life? But I want to tell you, I think based on what's happened so far, I think we're on the right track. So please make sure that we maintain concurrence with, obedience to what the state of Michigan, what our office, the county of Kent, and all the municipalities are asking you to do. And I'm going to turn it over to Teresa, and then we'll hopefully have time here in a little bit to answer any questions that are out there. But Teresa Branson, our Deputy Health Officer.
Thank you, Wayman. MB, I don't know if you can bring up the community resource list, but we put together about 7 ways that we've been utilizing that our community can stay connected. And so these are just some of the resources in terms of how to stay in the loop with COVID updates. So you can visit our webpage on Access Kent, that is listed there for you. We have a health department line, 632-7228. So if you are having COVID symptoms or wondering if you should get tested, you can call this phone number, press the different options, and get help. We have our Facebook page that keeps up to date with regular COVID updates. Our health officer, Adam London, usually does daily videos that are posted both on Facebook and on our county's YouTube channel. If you'd like to receive regular COVID updates, there's information on this document in front of you where you can go to subscribe to receive regular COVID updates on our Access Kent page. And then more recently, and somebody else on the line here on our team can probably speak a little bit better to this, but today we issued a news release on a KCHD web-based application for residents called keepmihealthy.org. And it's just a health screening tool, a health survey to potentially identify future COVID-19 hotspots in Kent County. So just a number of resources and things that we want to encourage you to use, encourage you to share these information resources with your community. Also, I want to point out that we have a team of people in partnerships that are working to ensure that we're getting this information in multi-languages. So if you go to the Access Kent website page, there's a tab that says multi-language information. So we've been working very hard with the Hispanic Center of West Michigan and Voices for Health to get the information in multiple languages. Also some of our videos in sign language. So we're always open to kind of hear how we can improve our communication efforts. And again, that starts with you and hearing what we can do to make sure, you know, the African American community is engaged and that we're reaching out to the appropriate individuals in the community that can help us spread the word. So we'll send this update to everyone who we have emails for on the call today and those that weren't able to join. And at this time, I think we have plenty of time to hear your questions and answers. So I want to remind people that they can use the chat box or MB is the line open for calls.
Yeah, people can use their phone if they would like to ask a question.
Right, and I see we have a number of questions already, MB, so I don't know if you
We
want
do. I'm capturing all of these, so I can start reading through these if you like, or if you want to take the ones that came in earlier, you tell me.
I think we can probably start with what's here, because some of the questions earlier have been addressed through some of the
Okay.
updates, and those that, if you submitted questions prior to the call, we will respond to those questions and add it to a frequently asked question document along with any questions that we can't get to today.
Okay,
I see
I'll
one
start.
of the questions. Yeah, I see one
Oh.
of the questions asked the question about whether or not we're flattening the curve or we're seeing the curve flatten. So maybe Adam, Dr. Bora, or Teresa, you can talk about that. I understand that we are seeing it flatten, but why don't you have a shot at that?
Sure, thanks, Raymond. Yes, we are seeing the trajectory of the curve flatten. As I mentioned earlier, the number of days that's taking for our cases to double continues to increase, and that's a very good sign. However, it does not mean that that our cases are declining. We're seeing a similar number of new cases day over day, and so the virus is still out there. It's going to be out there for a long period of time, and while we're flattening the curve and we feel confident that the trajectory of this has flattened, it's not going away. So we still have to all be mindful and follow the practices that we've been doing with social distancing and wearing masks and protecting ourselves and others, because what we have seen in other places in the world is even when their curve has been flattened, things can go bad very quickly. And so it's important that we maintain discipline to those practices.
Kim B, you want to manage the
Yep,
questions?
I'm going to start reading through. So starting from the first questions that came in. First one is, what is your policy practice on sharing where cases are? Community members are asking in order to protect themselves, but I'm guessing this is problematic for multiple reasons, HIPAA and stereotyping.
Yeah, and that's exactly right, MB. We would like very much to show exactly where cases are at. However, it would only serve to infringe upon the privacy of those individuals, and they really wouldn't tell you a whole lot anyway, because we know there's enough of this out there. There are enough people who are undiagnosed, but who are infectious, carrying it in the community, that we wouldn't want to create stigma against a person or a neighborhood or a community, when in reality, there are people in the community all the time who are carrying this. And that's why it's important that we limit the number of times we go out into the community. We wear the face mask, we wash our hands, because at this point you can assume that if you go out into the community, you're probably going to either be near someone who has it or in a place where someone who had it recently was.
Thanks, Adam. All right, next question is there opportunity to do any antibody testing in addition to the diagnosis testing for our community? So we really start to understand the spread and can provide resources accordingly, especially understanding the impact on our communities of color.
So
Rally, yeah.
yeah, sure. This is something we're looking into. At this point, it's not being recommended by the state health department, and it's not widely available right now in our community. But I think as we go towards opening things up and thinking about when are we really ready to get started with businesses and being out in the community, I think it's something that will definitely be important. It's also, I think, going to be valuable for essential workers as they head back into the workplace to know that they are not transmitting the disease and are also healthy. So something, yes, on the horizon, I think it will be there, not quite here yet.
Okay. This might be one for you. Can you explain what the urban region stands for and where specifically urban is located on the chart?
Mike Fortman, are you on the line? Maybe you can answer that question. Mike is our data scientist.
Yes, so actually, if you click on where it says the word urban, it will highlight that section of the map. It looks like MB's gonna try to get there.
Yeah.
So,
Oh, got it.
yep. So basically you can see that it's, right, that it's Grand Rapids, Walker, Granville, Wyoming, Kentwood, and East Grand Rapids. And again, as Adam mentioned, they're grouped together like that primarily for masking purposes, because some of those communities still have a somewhat of a low number. So for identification reasons, we kind of group them like this. As the cases grow, we might be able to kind of split some of these jurisdictions out separately.
Thanks, Mike.
Thanks. All right, next on the list, we have a lot. Can someone speak to what has been going on with juvenile detention with our staff and our residents, please?
Teresa, oh, you want to handle that, or Dr.
Yeah.
Bora, one of the two?
Yeah, so in terms of, we've had a couple, and this was in the news, we've had a few positive cases at the juvenile detention with youth and with staff. The leadership at the Kent County Juvenile Detention and at the court administrator's office have been working very closely with the health department on every preventative measure we can take to kind of make sure that the individuals that did test positive or individuals that were exposed are not at work, and that they were in quarantine, monitoring for symptoms. Individuals that were positive, whether they were youth or they were staff, that those staff are at home in isolation. And again, it's been a great, as a county department and as a critical service department or community, they're doing everything that they can. We also have communication to the parents and guardians, just so that parents and guardians of youth and juvenile detention would know, all the steps that we're taking to ensure the health and safety of the families. Juvenile detention also has screening in place for individuals coming and going. So that was kind of the situation. I think it's probably been probably about a couple weeks. So continuing to have conversations with them just to put some of those preventive things in place and making sure everyone is staying home if they're sick.
Awesome, thank you. All right, next we have, there have been a number of people stating that they didn't receive testing, but they are experiencing symptoms. Have you heard of these concerns, and could this contribute to some of the disparities that exist for communities of color?
So certainly, because the testing criteria have been so strict until recently, most people with symptoms, if they were not sick enough to be admitted to the hospital, would not qualify for a test unless they were a healthcare worker who needed to be caring for patients. So most people were not getting a test even if they had symptoms. Could be contributing to disparity. It's hard for me to say that right now, but it's definitely possible. But I'm really hopeful that starting next week, we're going to see a lot more tests available for people who have symptoms but are not sick enough to get admitted to the hospital.
Great, thank you. Following that, are there any free counseling services for families under stress for those without health insurance?
That's an interesting question. Teresa, I saw something come through from Cherry Health. I don't know if there's other information out there, but could you try to handle that? And if we can't provide a clear answer, we can get back with people on that one.
Yeah, the information that Tasha shared with everybody was in terms of testing and a hotline you can call to reach Cherry Health for individuals who may be in need of testing. So in terms of counseling, that is a great question. We have been partnering with 211. As Wayman mentioned earlier, public health has been on the front line of responding to the COVID crisis, but we know that there's a lot of other underlying needs in our community, whether that's mental health, stress, food, transportation, housing, people being displaced. So we really are partnering with different organizations So if anybody on the line knows of resources, free counseling for people who don't have access to that otherwise, the Kent County has a mental health crisis resource guide, and that is something I can send as a follow-up, because we know when people have those different stressors, it's going to create challenges when it comes to one's mental health and well-being. So we'll share the resource guide that we have when people need help in crisis, and also again turning to 211 just to who's documenting all the different types of needs, both those that are met and those that are not being met. But again, part of our call with all of you with community engagement is, you know, helping us. If you know of any of those resources that you can share, we'll certainly do our part too to get those posted and communicated to individuals in our community.
And our mental, go ahead, Adam.
Yeah, I was just saying, I want to thank our good friend Tasha Blackman over at Cherry Healthway. I've seen the chat boxes. It's pushing lots of great resources from Cherry Health, so thank you, Tasha, for that. They're a great partner and can provide a lot of tremendous service in the community. I'd also encourage anyone who's looking for help with behavioral health or mental health issues to go to the Network 180 website. Network 180 recently partnered with Pine Rest and Forest View and some others on a campaign they're calling "Don't Go Out, Reach Out." So they've got some phone numbers for telephone and telehealth counseling, so people can get access to the behavioral health care that they need right now. We know that's a huge situation right now and a need in the community. So Network 180 is another resource.
So I want to mention one thing as well. 211 is also a great resource for food insecurity. We're hearing a lot about concerns about people not having access to the food that they need. And they can really help guide that conversation.
Very good.
All right, next question. A few people have, let's see, Considering that Chicago's COVID cases have been escalating and we are situated between both Detroit and Chicago, does this impact the area's approach towards strategy?
Adam, you want to take that one?
Yeah, well, you know, I think we're looking at data from communities around the country, and we all recognize now that the world is so interconnected that this thing got from central China all the way around the world, creating a pandemic in just a handful of weeks. So yes, we're watching carefully what's happening in Chicago and Detroit, along with what's happening in areas right here in West Michigan. And we know that we're going to see, and we should expect that over the course of the next year, we're going to have both fluctuations in the curve of this epidemic. We're also going to see hotspots in certain areas within the community. And so we're watching that very carefully, both what's happening in communities next to us, but what's happening within communities within the community. So our epidemiology and surveillance team really has their hands full for the next year.
Awesome, thank you. Next we have, what can we do to ensure the safety and protection of our frontline workers who are often not given PPE in places like grocery checkouts and others like that?
Nirali or Adam?
Sure. I think that's challenging right now. It's challenging for everyone. And I think what we would recommend would be that we hope that everybody takes it upon themselves to wear a mask to help protect others. We know that wearing a mask, like a cloth mask, wouldn't help the person who's wearing it, but it would help everyone around to prevent spread of those droplets, which can be contagious. And so we hope that people going into these stores start really listening to some of that guidance as well. I'm seeing it happen a little bit more often than I used to. I think also if frontline workers are not feeling well, they should really be able to stay home. I would hope they have that support, that they don't feel that they have to come to work if they're not feeling well. And then I think just frequent hand washing is really going to be the way to go, and making sure that people who are working with others regularly are not touching their face at all, not touching their eyes, their nose, their mouth. I think that's where we are right now.
Yeah, we all share on this responsibility to protect them right now.
We do.
This is a responsibility that we all have, that eliminating those unnecessary trips out of the home, as inconvenient as that is, every time we do that, we're protecting those frontline workers.
Mm-hmm.
Great. Next question. Sheriff Napoleon in Wayne County has been able to reduce the number of people incarcerated in their jail from 2,500 to just over 900. what is happening in Kent County to protect those who some refer to as being in the petri dish due to the inability to self-distance? How have the numbers been reduced?
I believe the last time I checked, the number is about 30% reduction in the number of people that typically are in our correctional facility, as well as our juvenile detention. The sheriff's department's been working very closely with our judicial branch, with our court system, to identify individuals that aren't a threat to the community in any way, shape, or form, who could in fact be released on early release, as well as supported in a way once they're released, so that we don't end up having them go back into the system. So they have reduced the number of people there tremendously. I think the number was at 30%, just like in Wayne, just like in other parts of the country. We've been very proactive working with our court system to identify when opportunities exist for people not to be there, which I think has really helped a lot. Right now, the sheriff's department, knock on wood, at this point, they've not had any incidences of COVID, no related illnesses related to COVID. And I think they're doing a fantastic job managing that operation. So very, very pleased with what they've done so far.
Yeah, and they also have an infection control plan that they've worked with us on. So they have been very proactive in finding ways to identify, to test, and to isolate anyone who might become sick there as well. So I think they're doing a good job of spacing people out in the jail and make sure that they're caring for anyone who might become sick.
Let's see. Have the Grand Rapids hospitals received COVID patients from Detroit, and what is the impact on PPE availability for West Michigan patients?
So I know that Mercy Health has offered to take patients from their partner hospitals on the east side of the state, but I don't think it's happened because of logistics. And I think Spectrum offered as well. I don't want to say number. They may have taken a small number, if that, but I think there also have been challenges in actually getting the patients transferred. So it's really not had much impact on PPE use or our community.
Yeah, that's my understanding as well. The number has been very, very small. And now that they have an alternate care setting over in Detroit, it seems unlikely that they would need to move anyone else over to West Michigan.
Great, thank you. All right, the next one's a big one, and I think it's been echoed a couple times. It says, I have a concern about co-parenting with ex-spouses. When one parent is diligently following the stay-at-home orders and the other is not. This is actually happening in our house, and according to some social media sites, I see others with this problem as well. I feel it makes our efforts at home futile. It also exposes 2 family members in my household who have lung issues. Something needs to be stated at the state and county levels about this, because it will continue to increase exposure for all, as long as we vigilant parents are to adhere to our visitation schedules. I don't know if anyone can speak to that or has tips on what can be done.
Adam, why don't you take a stab at it? I have a couple comments.
Well, my stab, Wayman, was that's a great question, and that's one of probably a few that hasn't been brought to us before. So we could talk to a friend of the court, and we can look into what the best advice would be for someone in that situation and get back with everyone.
Yeah, that's kind of what I was going to say, is that if there are issues related to that, please make sure you reach out. The health department has the phone number 616-632-7228. So those questions can get raised on that line. We can provide the best answer possible for you in that situation. We also have United Way 211. So we have a certain ways, in fact, that you can reach out to us, and then hopefully we can provide you with the appropriate supports and counseling that you need to have to resolve whatever the issues are related to co-parenting and so forth. So,
and also, Wayman, I think I'll raise that issue with our State Bar Association, because I think that is a good legal question that should be addressed by the State Bar Association, working with the division of attorneys who work with, divorce and those sort of things. So I appreciate that question. I wrote it down.
Thanks, Mary Beth.
All right, next question. West Michigan has a high new immigrant American refugee population, many that are not literate and may not get all the excellent information about COVID-19. Are there ways to reach this population with translated pamphlets?
Yes, so there are some national refugee resettlement agencies that have worked to put together resources in many different languages. I think some of those are available on our website. Bethany Christian Services has also done videos in different languages that they've pushed out to their community members through WhatsApp. We have had a call with Congolese community leaders as well as Vietnamese community leaders to help get more information out in different ways. So those are some of the things that we've started, but I think this is probably going to be an ongoing conversation that we need to have. Our health department refugee nurses also took a couple days and called all recent arrivals with an interpreter on the phone to talk about COVID to make sure that they understood what was going on.
Great, thank you. All right, next. Well, we had a question earlier that was regarding, are there any specific implementations in place for students who do not have access to the necessary technology, virtual learning? There was one person that replied to that question and said, actually, Grand Rapids Public Schools is currently working to get tablets in the hands of students grade 3 and below and Chromebooks in the hands of older students. They should be reaching out this week. But if you have been missed, you can reach out to your school. I don't know if anyone else wants to speak on that or if that was enough.
I would just add that in any school district, if folks contact their school principal, that usually will help them understand the need that is out there. And then the schools have been trying to be responsive, whether it's trying to secure devices or hotspots when it's available or creating alternative methods to engage kids and families. So start with your school.
Yeah.
Who is that speaking?
That was Brandy.
Okay, thanks.
Brandy Lovelady Mitchell. Thanks, Brandy. And then I had a call earlier with Birgit Close from the Right Place about that. We have a very supportive community around these issues, the technical needs of the community. And so if in fact there's a school district or family that hasn't been able to make that connection, please make sure you reach out through 211 and provide that intel, reach out to the health department. We will make sure that that gets floated up and into our partners that have the ability to provide some resources that otherwise wouldn't be had. So please don't hesitate to reach out and ask that question.
All right. Will the health department or Kent County be providing clear instructions for safe returning back to normal life so that we do not have the virus resurge?
Yeah, so we're going to continue to communicate with everyone as information becomes available to us. I think that this transition phase, as we move from the flatten the curve, stay at home situation to returning to work, has some risks with it. And I think that there are things that we can do to reduce those risks. And we're going to be working very closely with officials at the state and at the CDC over the next few weeks, along with partners in industry locally, to identify what those best practices are, what those communication pieces are, so that we can put everyone in the best position possible to get back to work and to resume life on whatever time frame that may be. And I'm not saying it's the end of this month. I don't know. That's out of our control. But we know that things are going to be reopening hopefully in a phased, smart approach, and we will be communicating very clearly with everyone what they can do to protect themselves as that happens.
All right. Hey, Adam, this is another question for you. Are we collecting data on patients that test positive regarding whether or not they were essential employees? I don't know if your data is like that or not.
Our data focuses mostly on the contact investigation, identifying where people, where they live, who they live with, who their contacts may be, so that we can identify who may have been exposed to the virus. and who needs to go into quarantine. I don't think that there is a field in that for whether or not they do essential work or not. In fact, I think I'm pretty sure the answer is no. But that's a good question, and I think that's a good research question going forward is, was being an essential worker an occupational hazard or not?
Right. Let's see. Can someone speak to access to sexual health services during the COVID-19 pandemic?
I think Tasha did below in the chat.
Yeah.
Okay. I am, just so everyone knows, I'm going to be aggregating all of this information because I know some of the questions have already been answered in the chat, so I apologize if I am reiterating ones. Let's see.
We're also providing treatment for STIs, and we're looking into seeing how we can expand some more telehealth options through the health department.
Okay, thank you. What special precautions are in place for nursing homes and the homeless population?
So for nursing homes, there are very specific CDC guidance that they've been provided to help protect their residents. We also have a person here at the department who has been designated as their contact. And Dr. Bora and others have given a number of webinars to them about how they can best protect their residents. The state of Michigan actually regulates the nursing homes, and they have a team there that works on infection control in nursing homes as well. With the homeless population, one of the priorities that we noticed right off the bat was that there was going to be a challenge with individuals who are homeless and tested positive for COVID-19. And so we were able to work with the City of Grand Rapids and with Guiding Light Mission and with a number of other partners to create what we're calling a holding and isolation center at the Guiding Light Mission on Division. And we have staff there from the county that are caring for a number of people who don't have homes and who've been tested positive for COVID, in order to separate them from the rest of that population and limit the possibilities for transmission. I know the city and others are also looking at ways that we can provide more housing in the community for those who are homeless in order to physically spread out that population as well.
In terms of the nursing homes, we have a team from the health department that is going into a variety of different communal living situations like nursing homes, inpatient, psychiatric facilities, things like that. If there are residents who need testing but cannot get out to get that testing done, we actually have been doing those tests for them.
Great, thank you. Let's see.
We're bumping up against 1 o'clock or 2 o'clock MB, so we've got just time for a couple more questions and then we'll have to end the call.
Okay, there's one that came in towards the end that I think I'm going to rise to the top here. Are undocumented families being protected from the threat of ICE detainment and or deportation if they leave their homes to go to the hospital? And are detained families being tested and treated?
From the county's perspective, we do not share our information with who we're testing with ICE or any other organization like that. That's not a prerequisite for receiving care from the health department. Dr. Bora, if you have other information on how the hospitals are approaching that issue, and maybe we need to revisit this one and get back to everyone.
I mean, I don't have a clear answer, but I know that I don't believe that Spectrum Health, for example, they're not asking in their testing facility or their triage line if someone is documented or not. I know Cherry Health wouldn't either. But yeah, that's all that I know. I don't know about the other questions that were asked.
I have to exit from the discussion, but I just want to say I am so proud of our Kent County Health Department and how you all are handling this crisis. I've been observing and researching and looking at other places, and I'm just very pleased with the level of quality of service that you guys are providing and the collaborations that you're forming. So I just wanted you to know that.
Thank you, Mary Beth. That means a lot to us.
Thank you. It really does.
Great, thanks. Yeah. All right, we have 3 more minutes. We have one person who, well, 2 that can kind of go together. One has clients who are making masks and wants to donate them. Is there a central location where they can be dropped off? And to piggyback on that, somebody else has members of the community that want to provide support to underserved people in the community, what's the best way to find out what their needs are and deliver that support?
Yeah, so for the donations, the Kent County Salvation Army on Linden, I think it's 1632 Linden Southeast, they're acting as our center for receiving donations like that. And they're open Monday through Friday, 9 to 4. And then Mary, what was the second question, MB?
The second one was, if people want to help serve on the underserved population, what is the best way for them to find out what the needs are and then deliver that kind of support?
Yeah, and so 211 is also navigating those calls for people looking to support.
Okay.
The Heart of West Michigan United Way is also a place that people can turn to look to volunteer or to make a donation.
Great.
Just heard about the Refugee Education Center has a website as well, and they have a list on there of things that the refugee community needs, things like diapers and things like that. So that's another place that people could go as well.
There's a link in the comments as well for the United Way.
Great. Yeah, I will be, again, going through all the comments and a master document with all the resources and the questions and answers. Because I have 2 more pages worth of questions that I'm staring at.
Okay, that's
Good.
great. All right, I think we're at the end, so let's end the call. Teresa, do you want to have any parting comments, or Adam,
Yes,
or anyone else?
Yeah, thank you, Wayman. As MB was stating, we appreciate all the questions and everyone's time today. As long as we have your email on file, we will be able to follow up with you and get you the answers to your questions today. Also, any ideas and other ways that we may be able to engage and reach individuals in the African American community, we'd like to hear that too. We'll send out the resources on how to stay connected. And again, just appreciate your voices in the community to the constituents and neighbors and family and friends that you serve, and just encouraging people to stay home, stay safe, and to be well.
And just want to end with a big thank you to everyone that joined the call, and a big thank you to our team. We are so grateful and very proud of how we've responded to this thing. We're only as strong as the smallest community of our community, and we need to stick together, people. This is an opportunity for Kent County and for the rest of the state to really take a look at how community can respond to crisis. So thank you so much for coming on the call today. We will get answers back to questions that weren't answered today. Thank you, Teresa. Thank you, Adam. Thank you, Darius. Thank you, Dr. Bora. Thank you, MB. Thank you, Mike Fortman, and all of those who participated today, those who contributed. This is not just the county of Kent. This is the broader community that's reaching out and supporting one another. And so thank you again, everyone. We'll end the call, and blessings to you all, and please stay safe. Please be vigilant, and continue to do what we're doing as a community. Thank you.
Thank you, everyone.
Thank you.
Thank
Bye.
you.